Sorry, I clicked off that by accident. I caught with my finger. So yeah, every card has a control test, which should be negative, as it contains, it doesn't contain any antibodies within the well. But in cases where it is positive, it could be due to the patient maybe he's having an autoantibody, which in that case we wouldn't release the results. We would request a repeat sample to see what it came out as, and again, if the result was the same and was positive in the control well, we would perform further investigations. So the first thing we would do in that case would be to perform a basic DCT, which we can actually perform on board the analyzer, and this will detect if any IgG or C3 is bound to the patient's red cells. So moving on to the reverse group, this detects the antibodies present in the patient's plasma, and the plasma is reacted with the A1 and B cells present in the reagents. Yep. Again, if there's a positive reaction, it will agglutinate. So as you can see on this particular one, there is a positive reaction in A1 and B. So along with that, we do perform a basic antibody screen where we detect IgG antibodies which may be present in the patient's plasma. In cases where there are IgG antibodies present, they will react with some of the antigens on the screening cells. So if it's a new antibody or one not identified before, we would perform further testing, which would be a I-18 enzyme panel, and this would be to try and identify what the antibody is, and then a sample would be referred to the NHSBT in Barnsley. So this would then confirm which antibody had been detected. And along with this, they would also issue an antibody card for the patient. So, sorry, I forgot to mention that in these wells there is anti-human globulin antibodies, or IHG. So if IgG antibodies bind to the screening cells and red cells have the zeta potential, which would then cause them to rebel from each other, and the IgG aren't able to span the gap in the red cells, but instead the IHG antibodies bind to the IgG and form cross bridges so that visual mutination can occur. Sorry, I forgot to mention that before. So other tests we perform on board the analyzer are newborn cards. Just notice there is none on, so let's have a look. So yeah, these are our newborn cards. And these are used for neonates under 4 months, and they include the forward group only. As you can see there, you've got your forward group, your control and your DAT. And that's because neonates are at an age where they're yet to develop IgM antibodies. So there's also a DAT well, as this can also detect if any maternal antibodies are bound to fetal red cells, in which case this could cause hemolytic disease of the fetus and newborn, or HDFM, which we'll also call it. We'll also have confirm cards, which literally is just the forward group of the patient. So these are mostly used in emergency situations, such as major hemorrhage. So if this is activated, we can use these cards to quickly confirm the patient's blood group, so we can issue group specific blood. If we have a historic group, which is then confirmed on a new sample, or 2 historic samples, and we have a valid sample. So we do use these cards because they give the results quicker of the blood group. And as I've just said, there's no obviously reverse group on these cards. It is literally just the forward group. And the card doesn't actually need to be incubated. Instead, it can just be centrifuged straight away. And then afterwards, we would follow up the group with a full grouping screen. So we also have RH phenotype cards. Just see if they are up here. So these are our RH phenotype cards. And we would perform these in cases where a patient has an RH antibody, and we would give them obviously phenotypically matched blood if they've already developed one of the antibodies. The reason why we would do this, because if they've already developed an antibody, they're more than likely, are much more likely to develop another. So we also use these cards for patients who are frequently transfused. So those on our Gate 21, which is our haematology unit for patients, or sickle patients, as they are the frequently transfused, and are more likely to develop an antibody due to the frequency of the exposure to blood. And again, they would get phenotypically matched blood to patients who have multiple antibodies and are difficult to find blood for. So if they require blood urgently, we would give them phenotypically matched blood to try and reduce the likelihood of a transfusion reaction. As I have briefly said, I-18 enzyme panels are also performed on board the analyzer, as well as prophylactic panels and the basic DCT tests. So maintenance is performed on these analyzers once a week, and they are performed on a Saturday and Sunday. So what we use is a cleaner called Microcide, and that cleaner is used to clean the cell lines to remove any bacteria and contamination of reagent buildup. And then we'll prime the lines with system liquid, and we'll run the QC on the grouping screen tests. So as you can see on there, it tells you exactly what you need to do on your weekly maintenance. And on this analyzer, it is run on a Sunday. So we'll also perform our QCs twice a day on these analyzers on each side, as there's obviously two sides to the analyzer, which means it has two separate probes. And that's just to make sure that each probe is working correctly. Yeah. So some of the products that we store in blood bank are, first of all, platelets. And as you can see, we use lab-cooled fridges, freezers and incubators in this lab, as are manufactured twice the standard. So there's an internal probe which displays a temperature, and as you can see on this screen, the internal probe obviously then displays the temperature on the electronic screen at the top there. And if there's a breach of the range between 20 to 24 degrees, this will then alarm and alert us to a temperature change. The temperature is also recorded on these charts here for 7 days, after which they're then replaced and checked off by senior BMS. And then those are kept for 30 years, and that's for audit purposes. So platelets must be agitated as they can aggregate, and if they're not agitated, they're only valid for 8 hours. As you can see, we'll always keep a stock platelet in blood bank. And this is an APOS HD neg irradiated platelet. And obviously this is kept at all times for any emergency situations, such as the activation of the major hemorrhage. Otherwise, we do try to order in platelets just for patient requests. So when they're requested, we try to only keep one bag in at all times to reduce our platelets. So as you can see, the ones below are platelets that have been requested literally just for patients themselves. So moving on to our red cells. So as you can see, we separate our red cells based on their group and their D type. Just quickly go through, then I can shut the door so it doesn't alarm. So these, our red cells, they're stored between 2 and 6 degrees. And we can keep them up to 35 days. We'll also stock irradiated red cells. So we'll always keep 2 OPOS and 2 APOS. And these have been treated with Gamma-Rex to remove any inactivated lymphocytes. And these products are suitable for patients obviously at risk of a transfusion associated disease. So patients who've maybe had a bone marrow transplant or Hodgkin's lymphoma, basically they're the type of patients who would require irradiated products for life. So these are kept separate because the radiation damages the red cell membrane, so it damages quicker, and we can keep the products up to 14 days. We'll also have emergency units that are kept in our satellite fridges. And these are on certain wards throughout our hospital. So the emergency units that we keep on the wards are 2 O neg units, which are Big E, Big C and KEL neg along with CMV neg. And we'll have these O negative units in case they need to be used on a female patient who is of a childbearing age, as there is a potential for them to develop anti-D, which would obviously cause a risk of hemolytic disease of the fetus or newborn within the lady's pregnancy. So these products are pre-signed and they have a major hemorrhage patient tag, which we then cover up so that the clinician can fill in the details of whoever they have used the units on. So these must be returned to the lab within 24 hours to comply with the BSQR regulations, and also obviously to maintain traceability. So when we've received the patient details on the tag, we can retrospectively issue the unit to the patient, just to also help us maintain traceability. So that is our emergency units that are kept on some of the wards within the hospital. So we do we perform a stock take checks twice a day, and we try to keep within these limits before we place an order with OBOS. So we have, let me just quickly, just the none to be printed out. Anyway, I will just show you a example. So this is our red blood stock count. So as you can see, we have our stock levels at the side of what should be kept at each site. Then we fill in what we have at this side, any predicted returns, any requests in the lab, and then at this side, the number of units that we need to order. So we do this roughly twice a day, and obviously we have to do this before we're placing or whatever or boss, because if we've got enough stock, then there's no need to be placing extra orders. So we do manage our stock by putting the units with the shortest expiry to the front of the shelf, and then obviously with the longest expiry to the back. So those that are due to expire within the next 72 hours, we'll put little red tags on. And this is just to bring it to people's attention that obviously the unit is short dated, obviously to try and use those units first, as long as they're obviously compatible with the patient who is needing it. So on the front of the fridge here, we'll also do a print out of what is expiring. So as you can see, expiry in the next 1 to 2 days. We've got some platelets, and then underneath we've got expiry of 4 to 6 days. Just to bring it to people's attention to keep an eye on it, and then once that obviously starts to get down to 3 days, we can either send our stock over to Pinders for them to use there, or like I said earlier, it just brings it to our attention that we need to use them units first.